Welcome to today's episode. We're joined by Dr. Saravanakumar, an emergency medicine specialist and national president of Society for Emergency Medicine India. He heads the emergency medicine department of Dr. Mehta's Hospital, Chennai, India, and holds MBAs in hospital management and finance. Join us as we explore his insights on the critical role of emergency medicine in eating disorders. So, hello, doctor. Could you tell us a little bit about eating disorders and what you've experienced in your field?
Hi, thanks for inviting me over to this event. Yes, disorders are quite common throughout the globe, and statistics actually says 16 to 17% of emergency department visits, especially in US, have got some type of an eating disorder, mostly anorexia. And in US alone, closer to about 20 million girls and 10 million boys suffer from eating disorder. I'm sure that's pretty much the same across the globe as well, even though we don't have the exact statistics. So it's a significant problem and also not very well recognized yet. Broadly, if you look at it, there are three types of eating disorders: the anorexia, you also have bulimia, and you also have overeating disorders. I think anorexia is the most common, which we see in emergency departments for various reasons.
Okay, yeah, so thank you. So we know that eating disorders are a very serious issue, but they're also very new and not many people know about them. So what would you say are like common medical complications associated with eating disorders that you see in like general or maybe emergency practice?
Oh, yeah. So, see, basically, eating disorders or disorders of two kinds: mental illness and combination of that with physical symptoms. So when you look at eating disorders, pretty much most of them have got some sort of an underlying psychiatric disorder that varies from depression, obsessive compulsive disorder, and symptoms pertaining to psychiatric features. And it also is associated with a lot of drug use and abuse. So that's another factor. And the third thing around the physical symptoms, primarily due to anorexia or bulimia. Right? These are three broad groups. So looking at each of those, clearly these people have some sort of a depression symptoms, most likely, most commonly. And in terms of physical symptoms, they present with varied symptoms, starting from endocrine abnormalities, cardiac abnormalities, general malnutrition, skin diseases, and low immunity and gut motility. So it varies or kind of involves pretty much every organ system in the human body.
Oh, okay, thank you. So I know you mentioned like cardiac arrhythmias and lots of like cardiac like related issues. So how do eating disorders impact cardiovascular health on like a more broad view or like generalized?
Oh, yeah. So I think most of the eating disorders are associated with electrolyte imbalances. When I say electrolyte, there are two significant electrolytes which plays a part in inducing an arrhythmia. So potassium and sodium. We also have calcium and phosphate playing a significant role. But potassium causes significant problems in cardiac rhythms. So the sodium potassium channel, which we call in medical science, is very important in maintaining the cell's stability. And when electrolyte disturbances happen, this cell stability across the cardiac area, when it gets disrupted, you end up getting multiple arrhythmias. So that's exactly how they end up with a lot of arrhythmias and even sometimes cardiac arrest. So that's the most significant complication of eating disorder. And every year, closer to about 10,000 people die in US alone due to arrhythmias and cardiac complications secondary to anorexia.
Okay, thank you. So, once again, like going back to electrolyte imbalance, what are like the physical signs and symptoms of an electrolyte imbalance that like due to an eating disorder, and how serious can they get?
Oh, yeah. So I think there's a lot of physical symptoms, especially with eating disorders. So starting from your head to toe. So you got, for example, your appearance itself, right? So you're quite dehydrated, brittle nails, right? You can actually say these patients have got a lot of chest pain, dizziness, arrhythmia, syncopes as a neurological symptoms. Hypoglycemia is one of the common presentations in emergency departments. They also have cardiac arrhythmias, as we just spoke about. Chest pain is another common symptom. Gastrointestinal symptoms like gastric pain, distension, gastroesophageal reflux diseases are quite common with these people. Also, apart from this, they got psychiatric issues as well. So, depression and any sort of drug use is also quite common. So, they present with varied symptoms, and especially with electrolyte abnormalities, you see brittle bones and cardiac arrhythmias are the two common issues with these people.
Okay, thank you. So, sort of going back to gastrointestinal problems, I know that can be that can range from like constipation, bloating, acid reflux, or maybe like esophageal rupture due to repeated vomiting. And I know from like reading stories and things online that people use laxatives and like different pills to sort of facilitate that process. But that also leads to malnutrition. So how does malnutrition from an eating disorder often affect like overall physical health?
Yes, so I think malnutrition is again, so this is a vicious cycle, right? So typically, you got an underlying issue of eating disorder that leads to malnutrition, and you start trying to feed, and that again leads to a significant problem. So malnutrition in general affects every organ system in the body. As you know, it reduces the immune system, affects all the endocrine systems. Patients will end up with hypothyroidism, hypophosphatemia, and also dyselectrolemias, again with sodium and potassium channels. So malnutrition is a set of symptoms which eventually leads to the patient's death, unfortunately, because kind of say in simple terms, shuts down every organ system or critical organ system of the body. Right. Another common area we don't usually talk about is how this affects the renal system of the body. Renal system also plays a significant role in maintaining electrolyte balances of the human body. And significant dehydration and malnutrition also leads to renal failures. So I think there's a varied group of symptoms affecting pretty much every vital organ in the body, mostly around the cardiac and also your renal system.
Okay, so this is obviously very serious. You said it could lead up to like a person's death. So say if like you receive a patient, what immediate interventions are necessary when a patient shows you like these things like maybe certain severe dehydration or like an electrolyte imbalance like due to this eating disorder?
Yeah. So I think the most common problem is dehydration when they present, right, in mild to severe form. And the first and foremost thing we do in emergency departments is to correct their fluids as a treatment option. We also have to monitor and have a close look at their electrolyte parameters. And if there are any electrolyte abnormalities, along with fluid correction, we also manage or treat electrolyte abnormalities, usually around potassium and sodium. So the key to treatment as a first step is to rehydrate the patient adequately well, and then start looking at providing appropriate nutrition. So these are the two key areas of treatment. And also, as all these patients usually have an underlying psychiatric disorder, assessing their psychiatric status and any drug use associated with psychiatric illnesses also becomes very critical, and getting a consultation from psychiatrists plays an important role uh, in managing these patients.
All right, so like I also know that due to like going through undergoing like treatment, a lot of people can experience like mental health conditions like anxiety and depression, and that could also be like the foundation to their eating disorder as well. So how do like a lot of these like very critical mental health conditions like anxiety and depression once again, like how do they manifest in like physical symptoms?
Oh yeah, so I think most of these patients do suffer from anxiety or depression, and they got some history of either familial mental illness or a significant environmental issues, which is actually leading to these problems. Anxiety and depression can present with varied type of symptoms, and that's where we actually use American Psychiatric Association's scale or a tool to assess the degree or the level of psychiatric illness underlying as a part of an overall condition. So assessing psychiatric condition of a patient becomes very important. Also, the physical status of the patient in terms of their overall nutritional status, right? So mental health and also the overall nutritional status assessment is extremely important to manage these patients successfully.
Okay, so I know you mentioned like you have like a tool or like specific materials that you can use to sort of assess a patient. And like the sort of like physical symptoms that come with them are very like they're very unique and like they're specific to anxiety and depression, things like that. So what should be included like in the initial assessment of a patient suspected of having an eating disorder in an emergency setting?
Hmm. So in an emergency setting, clearly the first and foremost is to assess the patient and get a brief history, or in fact, a detailed history around their environmental conditions and conditions leading to such symptoms, and also an underlying history of mental illness, medication use, and familial history of eating disorders. Apart from that, you do a routine blood test or blood investigations to assess their electrolyte levels, their blood sugar levels, their kidney functions, and also an EKG to look at their cardiac rhythm. So assessing basic electrolytes, vitals, EKG becomes important.
So I know you talked about assessing vitals, but that includes like organs as well. And going back a little bit, how can eating disorders affect the endocrine system, including like thyroid function and blood sugar levels?
Yeah. So I think it's a very important question as eating disorders have got significant impact on the endocrine system, especially with the blood sugar levels. And it's interesting also to note people with type 1 diabetes are most likely to develop anorexia as well. So I think it goes hand in hand. So hypoglycemia is one of the most commonest presentations of patients with anorexia. So I think the first and foremost, all these patients require a rapid blood glucose assessment in emergency departments. Also, they lead to thyroid disorders like hypothyroidism. So that's a decrease in thyroid levels. They present with varied symptoms. So hypothyroidism and hypoglycemia are the most common symptoms associated with eating disorders.
Okay, so I know that when a patient is brought into the hospital with a very serious case, they're sort of like renourished or refed. What are the risks of like a patient being refed too quickly, maybe, and how should they be managed in like specifically for a patient being recovering from an eating disorder?
Okay, so a refeeding syndrome, we call it in medical terms, is a significant uh, disorder uh, affecting the people whom we try to feed, especially after a period of malnutrition, because of their gut system's ability to accept the feed is very different from a normal person. There are broadly two types of nutrition we can try with these patients. One, we call it as a parenteral nutrition. That's basically through your intravenous access. Whereas when you overfeed them orally, they end up in a condition called hypophosphatemia. So because of that, it also leads to significant gastric distensions, constipations, and also intolerance. So I think overfeeding syndrome is a common issue, especially for any patients who's malnourished and those who've been anorexic for a while. So I think that's one of the common issues in getting them back on track. So the nutritional supplements and getting them nourished again, it's a very slow process. And it also goes in hand with adequate support provided for their mental health condition and also behavioral changes and also not overfeeding them at immediately, but giving them supplemental nutrition over a period of time for them to slowly bounce back and also correct their hydration at the earlier stages. I think that's a key for a successful treatment.
Okay. Um, Like that makes sense to me, but going to the opposite end of the scale, maybe. So how could like chronic starvation or maybe binge purge cycles lead to complications? Because a lot of those like starvation or like um sort of like intentional starvation cycles is what leads to anorexia and a lot of like physical depletion in the first place. So how could those sort of like lead to physical complications?
So again, reduction as we spoke earlier. So broadly, there are three groups of symptoms, right? So anorexia, bulimia, and also overeating. So this is a vicious cycle. So where the patient or this particular person gets into one of these because of various societal pressures or mental illness. So they avoid or resist food, and they realize at the initial stages that the thought of having food is causing them anxiety. That's the stage most of them seek medical help. But many people, when they pass that stage, they get into this vicious cycle of anorexia or starving intentionally for even periods for more than 24 hours for various reasons, mainly to maintain their body weight or in the fear of gaining body weight. But after a certain period, they would like to feed themselves because they get hungry, or they start feeding, and that's where the guilt actually sets in. So they think they have fed more or they had more, but sometimes it's not the case. It's only a perception that they fed more, and they go into a mode of anxiety because of that. So I think this becomes a vicious cycle of anxiety and depression, and that complicates the problem further.
Okay, so it seems that the cycle is like, once again, it's a very vicious cycle. It cannot be broken easily. So what would you say are like the long-term effects of eating disorders on maybe like bone and muscle health?
Oh yeah, so I think so calcium plays a significant part in our human body in many pathophysiology, right? So eating disorder people also suffer from low calcium. So body naturally tends to absorb calcium back from the bones into the system to maintain those essential pathophysiology of human bodies. So this actually leads to thinning of bones. In medical terms, we call it as osteoporosis. So this leads to thinning of bones and also muscle wastage, right? So I think muscles, uh, so basically atrophy. So you see muscle wastage, bones thinning out, and also electrolyte abnormalities leading to cardiac problems. So chronic cycle of this leading to significant weight loss, muscle loss, bone density loss, leading to eventually cardiac issues and also death.
So I know like once again you said calcium is a very important mineral and it can be acquired naturally and it's what like humans need for like basic function. But in a very emergency setting, like what role do these like the reintroduction of vital vitamins and minerals play in like recovery?
Mm. Yeah, I think it's also dependent on the electrolyte parameter assessment, which you do at the initial stages of presentation to emergency departments. And your initial rehydration of the patient through intravenous route involves not just fluids but also electrolytes. So usually these are sodium containing liquids which are used at the initial stages along with maybe potassium to replenish in case if there is an hypokalemia and also correction of glucose. So once the sodium, potassium, glucose correction has been taken care of, we also look at the magnesium, phosphate, and also the calcium components. And those can be substituted intravenously as well based on the need for the patient. And also, this calcium, sodium, and potassium play a significant role in inducing cardiac arrhythmias. So we need to be extremely careful in managing these electrolytes because any overcorrection or undercorrection of these electrolyte parameters are also going to result in arrhythmias.
Okay, so once again, like I know that you said like overcorrection and undercorrection can be very like critical. So how should maybe say like focusing more on like one thing, how should like deficiencies be addressed in like a safe way?
Mm. So all these patients have to be managed inside the hospital and inpatient setting. They clearly need a short-term observation at least from 24 to 48 hours. As these electrolytes cannot be corrected fast, they need to be corrected very slow. And at the same time, they need to be monitored extremely meticulously so that we don't overcorrect it or overintroduce these electrolytes, leading to or inducing a cardiac arrhythmia. So most of these patients needs to be in the hospital, preferably in an intensive care setting for close monitoring and also all these electrical parameters are corrected over a period of 24 to 48 hours until the patient stabilizes. And that's a period where nutrition part and other nutrition part of the patient is also taken care of either enterally or parenterally. What I mean by that is through intravenous route or orally.
Okay, so I understand like that the process that it takes is very like it's a very long and arduous process. And obviously, not many people are very receptive of that process. So how should like a physician approach the topic of eating disorders with a patient who might be in like denial or may not want to receive any help?
That's a very important question, Darshan. As you rightly said, treating them medically is much more easier. So it only involves correction of fluids and electrolytes and nutrition. But the problem with most of these patients is the underlying cause for eating disorder, which is underlying mental health disorder. So once these patients stabilize, and if you don't treat their underlying cause, which is the mental health, they're going to go back to their usual cycle and they're going to come back again to an ED in a later stage with similar symptoms. So they think that's where getting appropriate psychiatric help becomes very, very important. And starting psychiatric counseling or diagnosing underlying psychiatric issues and simultaneously initiating treatment for correcting those underlying psychiatric disorders, either through counseling or through combination of drugs, becomes extremely important and critical. And these patients also need long-term counseling from psychiatrists on a regular basis, so that their overall behavior change can also be uh, implemented, or overall their behavior change is also corrected.
Okay, yeah. So, I know you mentioned that they should be given like certain treatments in the long term, maybe. So, what are like the most like most important like follow-up considerations for a patient who's been treated for like a short term like episode relating to an eating disorder?
Okay. Most of these eating disorders are usually not short term. So it's most usually mid to long term. As Because short term it's kind of confused with your dieting. I think that's slightly different from long term, and that's another problem with eating disorders, where initially it is thought to be an extreme form of dieting, which basically turns into an eating disorder over a period of time. So at short term, simply put, we look at the vital parameters, ensure the patient is hydrated well, the nutrition status is all right, and also the electrolyte parameters is fine. So more the patient develops a long-term sequelae of this into an eating disorder, that's where the problems of all this parameters in terms of electrolytes and other health disorders starts. I think the demarcation is extremely difficult to make, especially in emergency department setting. You see most of the patients coming in with later stages of their eating disorder, not at early stages. But those people in the early stages do seek help sometimes, and that's where early psychiatric counseling, intervention, behavioral changes make a significant impact in overall recovery of the patients.
Okay, yeah, thank you so much. That's all the questions I had for you today. Big thank you to Dr. Saravanakumar for sharing your expertise with us today. Your insights on the intersection of emergency medicine and eating disorders have been very valuable to me, and I truly appreciate your time and dedication to advancing healthcare. Thank you for being a part of my podcast today.
Thank you, Rakshan. I really enjoyed it, and good luck to you as well. Thank you.